The 80-year-old client is prescribed digoxin, furosemide, lisinopril, and aspirin. Which finding is most concerning? So we know that the digoxin is going to do what? Slow the heart rate. We know that the furosemide is going to do what? Patient going to lose, the potassium with the furosemide, lisinopril, and the aspirin. Patient might just have the cough and the aspirin is there as well. So patient has those 4 medications taken. Which finding is most concerning for this patient? Is it the blood pressure that is 140/78? Are you concerned about that? Not really. Is it the heart rate that is 56 beats per minute? Are you concerned about that? Is it the mild ankle edema? Are you concerned about that? Or is it the reports of mild headache? Are you concerned about that? So the 80-year-old is prescribed digoxin, furosemide, lisinopril, and aspirin. Which finding is most concerning? So out of everything, all of them is concerning, but the one that is most concerning is the fact that you have this patient and the heart rate is 56 and the patient is supposed to get digoxin. All right? Yes. Definitely. So the heart rate is 56. The patient is supposed to get digoxin. So if you go ahead and give that digoxin, then you're going to realize that the heart rate is going to go down a little bit lower. All right. And then probably add more problems to the patient. So the patient probably start having dizziness, all of those things. Anything less than 60 beats per minute, you hold the digoxin. All right. So 59, you hold it too. But you can always go ahead and check again. Check. And make sure that it says 61. All right. If it says 58, 59, it's still low. All right. But it's always good to check a second time and make sure that it's correct. So you hold it for that. The mild edema is going to be addressed with the furosemide. Reports of mild headache, you can say, okay, then the patient is getting a little aspirin, which might have that as well, which might help with that as well. And the blood pressure is going to be addressed by the lisinopril and the furosemide, all right? But the heart rate is the problem there. So bradycardia suggests possible digoxin toxicity, especially in older adults, all right? Which statement shows a need for further teaching about nutrition in older adults? Usually old, then recheck. Yes, definitely. Which statement shows a need for further teaching about nutrition in older adults? I'll increase fiber and fluids to prevent constipation. Hello, everyone. Thank you so much for tuning in. We're just doing some NCLEX questions over here. I think the live got disconnected. So, yeah. But thank you so much for tuning in. All right. So which statement shows the need for further teaching about nutrition in older adults? I'll increase fiber and fluids to prevent constipation. If somebody says that to you, do you think they need any further teaching or they already get the teaching? You understand? Yeah. So increasing your fiber and your fluids is going to prevent constipation. So you don't need to teach them anymore about that. I don't need as much fluid since I'm less active. That one you'd be like, okay, put a question mark beside it. All right. Then the other person or the other thing somebody might say is I should choose calcium-rich foods. Definitely, we need to be choosing calcium-rich foods from, birth up to until, close to your grave. All right. And I'll limit fatty and dry and fried foods. Definitely, we need to be doing that. Limiting fatty and fried foods from birth up until, close to the grave. So the one that is most concerning or the one that needs more teaching is the one that says, I don't need as much fluid since I'm less active. All right. So definitely you want to go ahead and address that person because older adults still need to take in the adequate amount of fluids. All right. They're at high risk for dehydration. And so we definitely need to encourage them to be drinking a lot of fluids. All right. Need my fried chicken and watermelon. Well, if you're probably like in the 80s, then I will be like, okay, then eat whatever you want. You understand? Because but really and truly, we need to encourage them to be eating properly and drinking fluids and all of that stuff. Hustlers Anthem. Hi, any tips for persons with diabetes? Yeah, we have tips for diabetes. We'll come to that shortly. All right, we'll come to that shortly. We're just doing some questions here, some nursing questions. All right, but I'll definitely get to you some information regarding tips for diabetes. All right. All right. So, which nursing approach is best when communicating with a client with Alzheimer's disease? Use open-ended questions to encourage thinking. Okay, I'll come to that shortly, Kelly. Which nursing approach is best when communicating with a client with Alzheimer's? Use open-ended questions to encourage thinking. Speak slowly, short, simple sentences. Repeatedly reorient to time and place, or correct the client's memory errors directly. Which nursing approach is best when you're communicating with that patient? Remember the patient has Alzheimer's. All right, how are you going to talk with this patient? Tash says B. Okay. Anyone else with anything else? What about my folks on YT? Blessed Soul says B. Okay. Thank you so much for tuning in. All right, so definitely you want to go with speaking slowly and very short, simple sentences when you're talking with these patients. All right. So using open-ended questions to encourage thinking. Probably you'll be there for the entire day. All right. And probably come back again the next day and they're still thinking. All right. Repeatedly reorient to time and place. Not going to really do much. All right. So you have to speak slowly, using short, simple sentences for these folks to actually understand what is going on. Because a lot of times, you know, if you're constantly talking and you're talking real fast, it tends to get them a little bit frustrated as well. All right, so you have to remember that. So simple, direct communication reduces frustration. Reorientation or correction may also cause them to become agitated. Usually will act out and get physical. Okay, definitely. Hi, Andrew Gresham. Welcome. All right. An older adult. You can go ahead and type your question, Kelly. All right, you can go ahead and type your question. An older adult with osteoporosis is at high risk for what? Is it falls and fractures, stroke, hypertension, seizures? Which of them are they at risk for? So osteoporosis, osteoporosis. Okay, it's a long question. So an older adult with osteoporosis is at high risk for falls and fractures, stroke, hypertension, or seizures. Which of them? So with osteoporosis, we know we have so Tash says A. Okay. No, I'm from Jamaica. So we know, okay, so we know we have a calcium problem there. Okay. So they're at risk for falls and fractures. All right. A lot of times you might find out sometimes they're lying still and they're getting, you know, fractures just lying there. All right. Without doing anything. So these folks are at high risk for falls and fractures. They call them spontaneous fractures. All right. So osteoporosis is equivalent to fragile bones, and that increases your risk for fracture, especially in the hip and the spine. All right. All right. So let me answer Kelly here for a minute. So, but I might, okay, so let me see. I remember, if you haven't followed follow me on my page here, remember to go ahead and follow. And you can also subscribe to my YT page as well at ThinkNursing. The entire live will be over there. There's a lot of questions regarding transitioning, you know, that we did. Nursing transitioning, answering a bunch of questions regarding, you know, credit card, credit scores, what else? Car loan, you know, health insurance, like a bag of things we that discussed today. All right, even love story, because eventually we actually turn love matchmaker now. You understand? So persons were asking about that as well. So go over there and just sit down and enjoy. get your popcorn and just listen to the videos. All right. But there's a lot of information over there. All right, Kelly. So let me see here. So you say it's a long question. Okay. I did a medical assistant after high school, but only worked for 1 month. So I'm kind of confused. My mom is pushing me to do that advice. I need a medical assistant after. Kind of confused. You can do it, Kelly. But I migrated from Caribbean. I want to try nursing, but I am scared to fail. No, just go be optimistic. Just be optimistic. Just go out there. A lot of persons go in the profession or they started out feeling the way you are now. So I would say, just go out there, put out your application, and you might find out, as soon as, you start one class, you're getting the strength, you feel motivated, and probably you go to the class and everybody in the class feel the same way like how you feel too. You understand? So just, if it is something that you really want to do, a lot of us are, scared of failure. Nobody wants to fail. But you won't know until you try. That's all I can say. So, put on your big girl pants or your big girl dress. Send out your application, do your interview, and go out there. As I say, you have persons who go out and they fail, and we're still failing. Them still a nurse practitioner, them still a fail. But they're still, putting in the work. All right. So that's the only thing I can say. Just take it one day at a time. Don't think of it that, if you're going there with a negative mindset, then, you just have to go pray a little harder. But I think you can do it as what Tash say, if your mom is pushing you, obviously she see potential in you. So go ahead and do it. All right. Ari, thank you so much for tuning in. So no, I'm not from Nigeria. I've never been to Nigeria, but I'm currently in the US now. All right. Not a problem. Not a problem. All right. So for pain management, an older adult with chronic pain refuses opioids. What is the best nursing response? All right. Are you going to say you must take your medication to avoid suffering? Tell me about your concerns with opioids. We'll try NSAIDs. They're always safe. Pain is normal with aging. So if you have an older adult who is having chronic pain, but they refuse taking any form of opioids, what is your best nursing response? You must take the medication to avoid suffering. Or tell me more about your concerns with opioids. We'll try NSAIDs. They're always safe. Pain is normal with aging. Pain is normal. And Tash is saying B, tell me more about. Okay, definitely Tash. So, blessed the soul, you definitely want to explore. All right, always go ahead and explore. Find out what is happening, why they don't want the medication. All right, and then from there. But never tell them that, pain is normal with aging. It's okay for you to suggest, trying NSAIDs. We're not going to say they're always safe because it's not always safe because it's going to be increasing their risk for bleeding as well. So you can always try other options, but NSAID is not always safe. So that is incorrect. And you must take your medication. You don't want to coerce any patient into taking any medication. You understand? I always say if a patient said they don't want pain medication, you can't force them. You understand? If they want to suffer and they're in their rightful mind, that's their, they have a choice. They have a choice to refuse. Not everything that we have to offer them, they have to take it. So just don't force anybody to take anything. Trying the NSAID is okay, but it is not always safe. All right. And pain is not normal with aging. Because you have some persons who are in their 80s and them pain-free. You understand? So explore the different options with the therapeutic communication, but don't dismiss or force the medications on them. That is their right to refuse. Definitely, definitely. No, I'm not in the Florida area, Ari. I'm sorry. I'm in the Texas area. All right. Which intervention is best to prevent urinary tract infections in older adults? Is it restricting fluids at nights, encouraging cranberry juice and adequate fluids, encourage frequent bubble baths, and use indwelling catheter for convenience? Which intervention is best to prevent UTIs, urinary tract infections in older adults? Restricting fluids at nights, encourage cranberry juice and adequate fluids, encourage frequent bubble baths, and use indwelling catheter for convenience. Okay, so that's true. That's true. They don't want anything for their pain. All right. So which of the intervention is best to prevent UTI? So are you restricting the fluids at night? Is that going to prevent them from having a UTI? Or when you give them the cranberry juice? Yes. All right, not a problem, Tash. Thank you for answering. Yes, so definitely the cranberry and adequate fluid is going to help with preventing, the UTI. So encourage them to drink a lot of fluids, all right, and then the cranberry juice. Encourage frequent bubble baths is going to kind of, you still want them to clean up down that side, so it's good to wash up. But, the bubble baths are going to also increase because depending on what they're using, it can cause, bacterial growth there. All right. And use of indwelling catheter for convenience. No, we don't give catheters for convenience. So anything you're introducing into the body is a risk for infection. So always stay away from, the long-term use of your indwelling catheters. All right. So always stay away from your long-term use of the indwelling catheters. Restricting fluids at night is not going to really prevent, the patient from having UTI. It's just going to prevent them from getting up every second to go pee and prevent them from having a fall, but it's not going to prevent them from not having UTI. So the correct answer is going to be encouraging the cranberry juice and adequate fluids. Hydration plus hygiene, proper hygiene prevents UTIs. Catheters increase the risk for UTI. It's after midnight here. Gonna go get bed. Thanks again. Not a problem. Not a problem. We can do this another day, but I'll try to come out around 7, 8 o'clock in the evenings. On Thursdays, I'll plan for questions, more questions like this, just in case you need someone else to study with. All right. So definitely join me here again on another Thursday. But in the week, I will talk more. And depending on how things are going, then I can also probably do 2 days of questions for NCLEX, and then from there. So, yeah. All right. So we'll have 5 more questions and then we will be finished. We will be finished with this for tonight. Because how long we on the live now? Kavion, not a problem, not a problem. Nice having you here. All right. So which medication combination increases fall risk mostly in elderly? So which 2 medications combination is going to increase the patient, the elderly patient to have a fall? Is it lisinopril and acetaminophen? Is it warfarin and simvastatin? Lorazepam and antihypertensive? And metformin and aspirin? Which 2 combination is going to put this patient at risk for fall? And if you think about what the medication is doing, then you'll be able to answer the question. So lisinopril is a blood pressure medication. Acetaminophen is a pain medication, but it's not a narcotic where you're thinking that it might make the patient very sleepy. All right? So definitely look at those 2. Is that going to put the patient at risk for fall? All medications are going to put patients at risk for fall. You understand? But look at these 2. That one, we could say it's okay. So we're going to give it a tick. Warfarin and simvastatin. The warfarin is a blood pressure medication. Simvastatin is a cholesterol medication. Is that going to put the patient at risk for fall? We'll go ahead and just say tick and make it be okay. Lorazepam and antihypertensive. Is that going to cause the patient to be at risk for fall? Lorazepam is something like a sedative. All right, so you're going to put the patient to sleep. And antihypertensive medication has side effects where it causes dizziness. It drops the blood pressure. So depending on how the patient responds to it, then you can actually knock the patient out. So those 2 combinations, the lorazepam and the antihypertensive medication, you definitely, either you're going to watch the patient, very, very carefully. But if you can avoid doing those 2 medications, you avoid it. All right. And then you have metformin and aspirin. Metformin is your glucose medication, the diabetic medication, and aspirin is an antiplatelet. You're not thinking about any form of the metformin can cause, depending on how it, how the patient respond to it, You can think that probably it will drop the glucose and, but it might take a long time, but we're still going to keep it there where it might drop the glucose and you might just get confused or, you might just get dizzy or whatever it is. So we'll keep it there, but the aspirin, you're not thinking about it causing, anything like that. So the two combination there would have been the warfarin and the antihypertensive, because one is a sedative and one is an antihypertensive, and both can cause like dizziness, hypotension or orthostatic hypotension, which eventually leads to fall. All right. So just look at the question and see what it says. What combination increases? So even though probably one of the two probably cause like dizziness, lightheadedness, which combination of the two medications going to cause the patient to be at higher risk? All right. An older adult with terminal cancer refuses further chemotherapy. The nurse should do what? Encourage alternative therapies instead. 2, document the refusal and notify the provider. Continue the scheduled treatments or convince the patient to reconsider. An older adult with terminal cancer refuses the chemotherapy. What is it that you're going to be doing as the nurse at that time? So you go to give the patient a medication. The patient says, nurse, I don't want it anymore. But the patient has terminal cancer. I don't want it anymore. This is it. I've been doing this for years. What are you going to be saying? Are you going to say, let's try something else? Are you going to document that the patient refuses it and let the provider know? Are you going to be saying, well, ma'am, the doctor ordered it, so this is your treatment, and get the patient connected, or, give the patient a medication? Or are you going to convince the patient to say, okay, then let's try something else? Most of the time we tend to do that, but just remember, this is terminal, and if the patient don't want to continue with the treatment, the patient have a right to refuse. You understand? The patient tired of it. So let the patient just do what they have to do. So document the refusal and notify the provider. But try not to be, like forcing the patient to try something else or coerce the patient into continuing something that they don't want. You understand? Do not that. Don't do that. Respect the patient's, decision, their autonomy, and just document, and that's it. All right. Which lab is the most important? Which lab is the most important for an older adult who is on digoxin and furosemide? So if somebody is on digoxin and furosemide and you're monitoring that patient, which of the 4 labs you would be checking? As we say, we know what furosemide does and we know what digoxin does. So when you're thinking about the lab, you're looking at which lab value. Are you looking at the potassium, the sodium, the glucose, or the calcium? So which lab is the most important for an older adult on digoxin and furosemide? So which of them you're going to be monitoring? Is it A, B, C, or D? Anyone on YT? Anyone on TT? All right. So the answer is going to be the potassium, all right? The potassium. Definitely, Roxy, the potassium. Because remember, the furosemide, what happens in furosemide, with furosemide? That can cause what? Potassium, low potassium, because the patient is peeing and losing potassium, sodium, all of those electrolytes. So you want to make sure you're monitoring that lab value. And what that will does is, so the patient is losing that. I remember with the digoxin on board as well, that can even worsen the fact that, the patient will become like, that will worsen the patient having too much digoxin on board. So the patient is going to have like digoxin toxicity. All right, so you want to make sure that you're monitoring your potassium level with that patient that is on digoxin and furosemide. All right. And, okay. Which intervention helps prevent pressure ulcers in bedridden older adults? So you have a patient that is lying down in bed all day and all night, and the family member refused to turn them. Yeah. Which intervention helps with preventing pressure ulcers in a bedridden older adult? Is it A, you massage in the reddened area? Is it B, you reposition the patient every 2 hours? Is it C, you restricting fluids? Or D, applying heating pads to bony areas? So which intervention helps with preventing ulcers in bedridden adults, all right? Is it you going and massaging that area that is already red and tender and sore that the patient has been lying on for days without turning? Is that something that you want to do? Or do you want to go ahead and turn the patient every 1 to 2 hours because this side is sore, it's red, it's tender, they're very uncomfortable. So you reposition them on the other side. Is that what you want to do? Okay, Shelly says B. Or do you want to restrict fluids? Are you going to be restricting a patient's fluid that has, because you're trying to prevent pressure ulcer? How the fluid become a problem? No. Do you really want to restrict the fluid? You want to starve the patient and the patient is already, bedridden and, probably having wasting of the muscle. Or do you want to go ahead and apply heating pads to those bony areas? You're going to take up this hot heat now and just put it on the patient bony prominences. Patient don't have any skin because remember, as we age, we lose our fat. So we don't have anything to cushion us. You understand? So do you want to go ahead and apply heating pads now to that little area there and give the patient a 1st degree or 2nd degree burn? No. So you're going to go ahead and reposition the patient every 2 hours. So every second we're going to have to get out of our beds, or every hour we're going to get out of our beds and reposition, put a pillow over that side, put one over that side, Patient going to be uncomfortable, but at least the patient is not going to be in a ton of, pressure ulcer. All right, so definitely do that. Never massage that reddened area, all right, of the patient because there is skin breakdown or, or even if the skin is not hasn't broken down or anything, you don't want to go there and cause any further, problems with that area. So turning schedule prevents breakdown. Massage, avoid massage or redness on or heat is also encouraged, or you're supposed to avoid it. All right. And then the last question we're going to do is one of the bonus question, thermoregulation. All right. Older adults are at greater risk for hypothermia because, I think we talked about that earlier, because A, they have increased metabolic rate. All right. B, they have thinner subcutaneous fat. C, they produce excess thyroid hormone. Or D, they retain more body water. So older adults are at greater risk for hypothermia because 1, they have increased metabolic rate, they have thinner subcutaneous fat, they produce excess thyroid hormone, or they retain more body fluid or body water. Which one is it? So lots of time our older folks will be like, oh, I'm so cold, but you're feeling so hot. But we are very well cushioned. But these folks, they've lost a lot of their, their subcutaneous fat. So they don't have anything there to kind of help with, keeping them warm. So definitely Roxy, yes, B. They have thinner subcutaneous fat. So you have to think about hypothermia for those persons. So even though probably outside is, let's say 50, and we're probably okay, you realize that sometimes you see our elderly folks well cuddled up, in their blankets. That's because they don't have the little fat there to kind of help with, keeping them warm. All right. So definitely you want to think about that. Thinner fat and decreased thermoregulation is equivalent to hypothermia risk. All right. So definitely you want to do that. All righty. Dr. Mohammed Damin. Yeah, Mohammed Damin. Hola, welcome. Shelly, welcome. Thank you for tuning in. How are you guys doing over there? All right. Chicken Head, you're joining late, man. Welcome, though. All right. You're joining late. All right. So we will come back another day with more questions. All right. And as usual, if you have any questions or any concerns, you can always reach out to me. Send me a message. All right. Send me a message. or just watch the videos and comment underneath, and I'll try to comment back, you know, respond to you as well. And remember to follow me on YT at ThinkNursing. I share the full length of the videos. So if just in case you come on a little bit late, then they will be on YT, the full length. So go ahead and check them out. It has a ton of information regarding nursing, transitioning. You know, we talk about everything. So, but a lot about nursing transitioning questions are on those lives as well. So definitely. The next live is gonna be, I'm trying to be a little bit more consistent. All right, I'm trying to be a little bit more consistent with my live. I'm gonna try to do my live around 7-8 o'clock. I'll definitely post it on my page. All right, because it depends sometimes on, you know, time I finish up with work and all. But I'll try for that time period. But if you guys can tell me what time is a good time for you. I know some of you guys came on late, but I started at 8 o'clock for today. During the week, I was doing 7 o'clock. So 7 o'clock on TT, and I'm trying to start on YT, where I'm streaming on both platforms. All right, so I'll try for 7 o'clock during the week. On Thursdays, I will do 8 o'clock. Seeing that a lot of persons were out for 8 o'clock, or we could try for 7 o'clock. Yeah, I'll do for that time for, you know, more questions, or I'll probably do 2 days with the question. 8 is good every Thursday. Okay, okay. And probably, I was thinking probably could do one more day in the week. I don't know, but you know, we'll work with Thursday for now. And then from there, I'll see what the outlook looks like for, you know, next week. We'll see what it looks like in terms of persons showing up for the live during the, you know, the 7 o'clock. And if I have a good turnout at 7 o'clock, I might do probably Tuesday, Thursdays, where we can do more NCLEX questions, because I know a lot of persons are preparing for NCLEX, as well as the RENR, which is the regional exam for the Caribbean. And so hopefully the questions will help them. You can still ask any questions or any concerns you have. You just share them with us or with me, and I'll try to answer. All right. But I do appreciate you guys taking the time out to check in with the live and be answering. Really do appreciate that. Shelly, I'm going to upload the other video to YT. All right. I think it's loading. So definitely you can check out that first part of the video. And we were going through some questions. So you can check them out. Good night, Roxy. Good night, good night, good night. So until then, you see from when we get food, I'm hungry. But I'm going to be eating, egg and bread and baked bean. Not supposed to be eating at this time, right? But yeah, I'm going to have my bread, egg, and baked bean, and then go to my bed. Probably go and watch a movie. Yeah, Sullivan's Crossing. Gonna watch Sullivan's Crossing before I go to my bed, because I'm not working tomorrow. And then from there, I will see you guys tomorrow. All right. So it was nice meeting you all, I guess. Nice talking with you guys. And as I say, if you follow me, I'll follow you guys. All right. And I'll share your content, engage with your page and all. And then from there, okay? Until then, peace out. Enjoy your night now. All right. Bye, Shelly. And whoever just came on, enjoy your evening.